Hi, my name is Dr. Joel Rosen, and I am really excited that you're watching this video today because I want to let you know that you can beat your knee pain. You are watching this video because it's yourself, a loved one, a family member, someone you know that you care enough about to try and find out more information about your knee pain. Now, that knee pain may have been something that you had recently, but I'm probably guessing that it's something that you've had for a long time because otherwise you wouldn't be looking for a different solution for your knee pain. So first thing I want you to understand when you watch this video and take the time to watch this and get some awesome information is the fact that you have a knee pain problem that's been there for a little bit longer than 3 months more likely, and you're looking for a new solution, and I want you to know that you can beat that knee pain. So I'm going to provide you the information on how to do that. In this video, I'm going to be going to show you the latest cutting-edge therapies that are out there and approaches to help with your knee pain. It's a non-drug. These are breakthrough treatments, and it will help you eliminate your knee pain, finally. So have a pen and paper. I want you to write down any questions you may have, any ideas that I may present to you, and when we see each other, you can present those questions to me, or if you watch the video and you find that you don't have them, then that's fine too. So, all right, so a little bit about myself. My name is Dr. Joel Rosen. I am a chiropractic physician that's been practicing chiropractic for 12 years, and I also practice functional medicine. I am currently a graduate of the Functional Medicine University, and that allows me to be a certified functional medicine practitioner, or certified functional medicine practitioner, exactly, CFMP is what it's called. And I am also currently enrolled in the American Functional Neurology Institute. I have studied under Datis Karazian. He's the author and the foremost studier of the thyroid conditions. And I am also studying under Dr. Michael Johnson. He's got an awesome group of doctors. There's a great website called lifechangingcare.com. If you go on there, it's called lifechangingcare.com, and you can find out about all the different conditions that we work with. I'm also a past certified strength and conditioning specialist. I have an exercise physiology rehab background, so knee pain is something that I can absolutely help you with, especially with all the new information, neurology, functional medicine that I have underneath my belt these days. So let's talk about this chronic knee pain. Chronic knee pain is something that you've probably had, like I mentioned earlier, for longer than 3 months, and you're looking for a new solution. So I wanted to discuss today with you the medical approach, my approach, specific testing that we'll be doing in my office, and how that testing and information gained will be able to help you recover with your knee pain. So let's talk about the medical approach. Typical medical approach is you go see your medical doctor, and what does he or she do for you? She may order an x-ray, may order an MRI. It takes forever to order an MRI, and they come back and say, oh, you have arthritis in your knee. And so what do they do for you? They can recommend physical therapy, and you've probably done physical therapy, and physical therapy could be great, but you're watching this video because you are still suffering. They may offer you some medication, some anti-inflammatories, some cortisone, maybe an injection. They may offer you some pain meds. They may start wondering what's wrong with you. They may give you some kind of antidepressive, something wrong with you because we can't help you. Or they give you maybe antipsychotics or anti-spasms. So they give you muscle relaxers. So many different things they do that may be good initially, but if you're going on for 3 months, something's going on. The neurological system is not functioning properly. What else do they offer you? Surgery. Surgery is an expensive proposition. So let's go back to the medication. The medication, I forgot to mention, a lot of side effects. Your liver and your kidney have to metabolize that and clear that from your body over and over and over again. You start having metabolic issues, start having liver sluggishness, start not water retention. So a lot of problems with the kidney and liver when you take medication for too long. So as we know, we have very serious side effects. Also, what will they do also? They'll also recommend surgery, but they don't want to do it right now because you're too young. They want to do either a arthroscopic to see how much tissue damage there is, or they already know how much tissue damage there is, and they want to do a total knee replacement. And you know, and I know that that's not the road you want to go. And if you do go down that road, you have to do it when you're old enough so that you don't have to do it again. And a lot of my patients will tell me, if I can just hold off for 5 more years or 10 more years. In that 5 or 10 more years, you're still taking medication and you're still not living the life that you want to live. You're not bending, you're not traveling, you're getting in and out. Every little thing that you do hurts, and you want to get better. So let's talk about my approach. What do I do in my office that's different? Firstly is we're going to do a very, very thorough neurological examination. And maybe, why are you going to do a neurological examination? I got knee pain. I know I have knee pain. Well, first thing you need to know is that when you have pain, that's your neurological system or your nervous system telling you that something's wrong. But when you have pain for a chronic amount of time, then neurologically you start breaking down. And when you start breaking down neurologically, then it's not just the source of pain, the knee, that's causing you pain. It's other things that are causing pain neurologically that we need to focus on. So start looking outside the box at the big picture and figure out how we can help your knee without just giving you medication, surgery, physical therapy. We're looking at treating the entire neurological system. Has to be thorough, so we do a very, very thorough exam in my office, which you may have already had or you're going to have or wondering to have. And so our thorough what do we do? What are the things we do for your neurological examination? First thing we do is we test your vibration, your ability to sense any type of vibration to your body. And this is really, really important, because what it is it's testing something called your large diameter afferents, LDAs. Your LDAs are basically your proprioception, your ability for your brain to sense any stimulus to your body, from hands to legs to arms to knees to feet. And you should basically, in a normal functioning neurological system, you should feel accurate sensations. So you should feel it the same from left to right, from up to down. And you'll be surprised to notice when you have some offsetting and not ability to feel things, that your large diameter afferents are starting to demyelinate. And when that happens, not only does our large diameter afferents tell us what's going on with our body and our skin and our legs and our hands and our feet and our toes and our knees, it also inhibits pain. So here you are with chronic pain, your large diameter afferents are not functioning properly, they're demyelinating potentially, and they're not inhibiting pain, and we need to try to address that as well. So we need to do that. These pathways, basically they'll demyelinate, they travel very fast, so when I touch you or do the vibration, you shouldn't be thinking about it, and you shouldn't be thinking, can you do that? If that's the case, you have a problem. So we need to determine if that's a problem. They, like I said, they inhibit pain, and when they're functioning optimally, you don't have chronic pain. Other tests we do is we do joint position sense, so it tells us if your fingers are going up or down, if your toes are going up and down, if they're going in and out. If you have a problem with that, there's that LDA problem. We also test your reflexes. Now, reflexes are not necessarily testing your large diameter afferents, but there's telling me with your reflexes if there's any cord problems or spinal bone problems, vertebral problems. Potentially there's compression in your neck, compression in your back, and here you are doing physical therapy to your knee or doing injections to your knee, and meanwhile you have a reflex problem, and the sensation going to your L3 or L4 is diminished, and you have some cord compression. You need to focus on that. You need to do some kind of treatment for your back as well as your knee. We also do eye movements. Eye movements coordinate balance, so potentially if your balance is off, you're weight bearing too much on one side versus the other side, and we need to fix your balance, and we can only tell that through the thorough neurological examination through the eye movements. We also do balance testing, finger to nose testing, cerebellar testing, really awesome neurological tests to rehabilitate and find that, oh my goodness, my knee's feeling better. So it's not just a knee problem per se. So one of the questions I always ask my patients is, why do you have this knee pain? Why do you think you have this problem? They say, well, I injured it a long time ago. And that's the thing, a long time ago, it never got better. And they think it's more of an age-related problem. The most common question or response I get to the question is, it's osteoarthritis. And I gotta tell you, yeah, it could be the bones break down or the joints wear out, the knees start rubbing together, creates inflammation and swelling, like Fred Flintstone's thumb, like he hammered a nail and he missed and it's throbbing. That's the case, it is throbby. But why don't everyone that have osteoarthritis have knee pain? Studies show that you may have osteoarthritis, you may have severe osteoarthritis, but you don't have any knee pain. But yet you have osteoarthritis and you have knee pain. So what's the difference between the person that has way more osteoarthritis than you, but still has knee pain, or no knee pain, and you that has osteoarthritis that has knee pain? So that's not a good enough answer. So you're probably wondering, okay, what are you going to do what are you going to do for my knee? And you've been talking about my nervous system and my large diameter afferents and my ability to balance, but what are you actually going to do for my knee? So that's what this slide's about. We're going to do class 4 laser. We're going to do something called infrared treatment. We're going to do something peripheral neuropathy treatment, or something to waken up those nerves and help the LDAs inhibit pain better. And we potentially will do spinal decompression, which we found from your reflexes and other testing neurologically that you had something going on with your back as well. All these things will help your nervous system heal the knee pain. So let's talk about the laser. We have something called the Avicenna laser. It's a class 4 laser, which basically class means it's FDA approved, or FDA cleared, FDA cleared. And it basically means that the strength of the laser is such that you have to wear eye goggles. So we wear eye goggles when we're doing your laser for your knee. So what does a laser do? So basically the first thing that it does is it helps the cell reproduction and growth. So if we have an injured knee, the cartilage tissue is degenerative, it's not regenerating, it's worn and torn, we need to reproduce that, and the laser will help reproduce the cellular activity. The other thing is it helps wounds heal quicker. So if we had a cut, the laser will help stimulate fibroblastic activity. That's an immune reaction. So if there's swelling in the knee, then it will help that activity heal quicker, and this will help recovery time. It also increases metabolic activity, which is basically helping the cells regenerate and rebuild faster, vibrate more, go through the electron transport chain and Krebs cycles quicker. So everything helps heal it quicker and helps the immune reaction or immune system function more optimally. Fibrous tissue, scarry tissue, you may have had surgery and scar tissue, and that's not allowing you to lengthen your muscles optimally. That will break all that fibrotic tissue down, which is awesome stuff. It's anti-inflammatory. It helps with immune reactions, bring in new white blood cells, and all these different immune inflammatory reactions that are occurring in our body. Helps that regenerate and turn over a lot quicker. It also helps nerve regeneration. Nerve regenerates really, really slowly, and by increasing your metabolism and cell proliferation and growth, it's going to help that knee heal quickly. It's going to help with pain, so that's what we're here for. So I just want to again thank you for watching this video. A lot of people have a lot of knee pain or other conditions, and they don't want to do anything about it, or just pray that it will go away, and here you are watching it. So your health is a really important investment, and I'm glad you're watching this right now. A lot of questions I get is, does my insurance cover it? And what I tell patients is you come on in and we'll do a complete neurological examination, and I will have David or whoever's here verifying your insurance to let you know what kind of coverage you have. I'm also going to do my best to give my best recommendations as to what I found. Not everyone's the same. Some people may have lower back problems, some people may not. Some people may have knee problems as well as neck problems, some balance problems, large diameter afferent problems. So I'll give you my best recommendation when you come back. I also want you to know that the information I'm giving you right now, if it makes a lot of sense with you and you don't do anything about it, then I can't help you and you can't help yourself. So, information without action is basically death. I mean, you have to apply what you know. Your body will heal if it's given the right therapies to allow it to heal, and the right approach to allow it to heal, and the right tools. And between the infrared, the peripheral neuropathy rehab therapy that we have in our office, the laser, which is a standalone treatment for people, I can really do it on my own. We also have awesome nutritional supplements that will decrease pain, decrease inflammation, help with your immune system, and it will basically help you heal quicker. So what I want you to do is I want you to write down any questions you may have and bring it back with you for when I meet you again, or I meet you for the first time. if we're doing your report of findings, you got to make sure that your spouse comes with you, because it's my office policy. I don't sit down and explain what's going on if your spouse is not here with you, because there's a lot to understand, and that's just an office policy I have in mind. I look forward to seeing you when you come in next time. Thanks for watching this video. And once again, my name is Dr. Joel Rosen. Thanks.